Welcome to the OncoPT podcast, where you'll learn from oncology experts, practitioners, and patients to help you on your journey to become a confident and competent OncoPT. Here's your host, Elise Cantu.
Hey OncoPT, and welcome back to this episode of the OncoPT podcast. We are continuing with our amazing preview series for the upcoming Cancer Rehab Community Conference happening on Friday and Saturday, November 7th and 8th, 2025. And today, I am so thrilled to welcome Dr. Karyn Jarrett to the OncoPT podcast to talk about her session called Utilizing Implementation Strategy to Guide Prospective Cancer Surveillance in a Large Healthcare System. And I am really excited because I feel like this title really, and I was talking to Karyn about this just before we hit record, I feel like this is a little bit of the nuts and bolts of the how we make cancer rehab actually happen. And so I'm so thrilled, Karyn, to have you on the podcast. Welcome. I was so thrilled that you said you were already a listener, so you know how this goes, but it's really exciting to have you on the hot seat actually on the podcast today.
Thank you so much for having me here.
So Karyn, would you mind telling the listeners a little bit about you and your practice and how you got into cancer rehab in the first place?
Yes. So my name is Karyn Jarrett. I am a doctor of physical therapy. I am a certified lymphedema therapist, and I am a clinical specialist in oncology rehab. So board certified, yes. So a little about my story. So I started my career in lymphedema therapy, and I've always worked in an outpatient setting. I work here in Central Florida, and the clinic where I was working, we had a really good relationship with lymphatic surgeons. So I was seeing patients before and after lymph node transfer surgeries, and supporting those patients on that journey was super exciting. I did that honestly, I continue to do that now. But I did that for a while. And then I started to lecture at UCF, so University of Central Florida, about lymphedema therapy, which was also super exciting because as a student there, I didn't have very much education about lymphedema therapy. And so that was a great way to give back.
Nice.
Then in 2019, the oncology board certification exam became a thing. And so I shifted focus from lymphedema to oncology. And that process of applying for and studying for that exam was career changing. And so, and I say that because even doing the case study piece, you had to submit your case study and you got feedback. And I was submitting my case study. I was super excited because it was about this lymphatic surgeries and how we're supporting our patients. And they came back with me, what about prospective surveillance? And they referenced Nicole Stout's 2012 article, which I had never read before.
Sure.
So then I'm reading the article and I'm like, oh my gosh, yes, what about this? You're right. And so I'm like, okay, our opportunity is that we could have done more for prospective cancer surveillance.
Mm-hmm.
So fast forward, I passed my board exam. I start teaching the oncology lecture at the University of Central Florida.
Nice.
And everything's kind of moving in the right direction. I start to implement prospective surveillance in my own practice. I have a really good referring physician, measured out the timed up and go. Okay, I started to do grip strength, felt like, okay, we've got this under wraps.
Sure.
And then it got to the point that I don't know, I guess I was looking for a challenge. We had some surgeons that left to another big healthcare organization in the area, and I followed them, and I became a program manager. And so my role was clinical program manager for oncology and lymphatic therapy across both a Central Florida division and an East Florida division. I was also responsible for opening a brand new clinic, an oncology and lymphedema specific clinic, a specialty clinic, and was still a treating clinician. So 3 different hats. And that transition into leadership, it was huge. There was so much to learn. It was time management. It was like drinking from a fire hose.
Mm-hmm.
It was being okay with not getting everything done, because there's so many different things happening. And then in the fall of 2024, I attend the Cancer Rehab Community Conference and left that conference feeling super inspired. I'm like, I don't know what's next, but something great's coming. And I sit down and I talk to my leader, and she shares this tidbit about a course she went to on implementation science. And she's talking about this knowledge to action framework, and she shows me this. And I was just floored. I was like, how did I not know about this before? I felt like I was lost and wandering. Like I knew what I wanted to implement, but I didn't know exactly how. I learned so much in the past year, but really wasn't ready to like, okay, how are you going to like make this big change, this system level change? And she gave us the map, right? She showed me the article with the map. And from there, I applied to be a speaker for this year's Cancer Rehab Community Conference because I felt like, okay, I needed to know this, and like, who else needed to know this? Who else needs to know this? And so how can we go ahead and fast forward to get all that information to be able to share with everybody?
There's so many nuggets, Karyn, that I want to pull out. And I want to first focus on that last part of what you just said. I think this is a really common experience that we get in oncology physical therapy or oncology rehab, especially if you work more on your own or maybe aren't in an environment where you can constantly kind of be in that like community with other therapists. I mean, I can't tell you how many articles like that, Karyn, where I'm like, I've never heard of this concept before. I would have never thought about this before. And I also like, selfishly, I think that's also why I do the podcast, so I can get this information, because I can't find it all on my own. And that's not what we're supposed to do as, clinicians. That's not the expectation. But it's being in this community where we're exposed to other perspectives, other, practice environments and other challenges in our, respective communities that we can really come together to build a stronger field of cancer rehabilitation. And I love, first of all, selfishly, again, that you walked away from last year's conference and were like, oh, something is coming. I can feel it.
So inspired.
Love that so much. But then you took it and you ran with it, right? You didn't just say, I'm waiting for something to come. I'm going to go out and make that thing happen. And so, the universe, serendipity, whatever collided to bring you to this point of implementation science. Now, I've had a small experience or, dipping my toes into implementation science through Dr. Jimmy McKay, who is the host of PT Pintcast. And I feel like this is something that he has really latched onto and is really working to advance in the physical therapy profession. Could you, for the listener who's maybe not super familiar with like, what is implementation science? Can you give us just a little tidbit on what it is, what that means?
Yes. So it's bridging the gap between what we know and what we do, right? So, and the beauty is there are a lot of different frameworks to help bridge that gap, right? Mm-hmm. And so in my talk, I'm going to talk about like the knowledge to action framework, but it's not the only framework. And the cool thing is that there's even like systematic reviews of frameworks, right? So there's like, this one's made of like 30 different frameworks, and they brought them all together, and then they created this knowledge to action framework. Mm-hmm. But it's that bridging that gap. It's we know that there's evidence that exists, and how do we put that into practice? Like, how do we change our practice to make sure that we're practicing at the top of our profession, mm-hmm. That we're preeminent? I feel like that's really the base of it. That's the base of implementation science.
Mm-hmm. This is a figure that I think we talk about frequently on the OncoPT podcast, but, I think it takes on average like 17 years from when research is published. Yeah, right? Like, I'm sure that's where we're headed. Yeah. To then actually get implemented into clinical practice as like, this is the standard. And that's far too long. I mean, that research is a full-blown adult at that point, almost going off to college or whatever. We don't have that kind of time to wait around, but this is a very common frustration that we hear in the cancer rehab field, which is, I understand and I see the value of this research that's coming out, but how to take it from, this is the paper where everything was really well controlled and, mm-hmm. like all the parameters were accounted for, and then putting it into practice in the, and I say this with love, the messiness of clinical reality. My patients are dealing with not just the cancer and the side effects, but also the life that is happening around them. We have the demands put upon us as physical therapists and, rehab professionals, as like part of your job is to do certain things. And so that can be a real challenge for a lot of us, and a real frustration point of like, I get it, I see the value, but like you said, that bridge I think is not there for a lot of us in cancer rehabilitation.
Yeah, and I think one of the articles that I'll reference, they talk about, implementing prospective surveillance, and they did it, I think it was between 2017 and 2022, right? And you're like, oh my gosh, 5 years, right?
Mm-hmm.
When you think about 17 years versus 5 years, you've sped that up, and that's implementation and sustainment, right? And so it's not that this is a fast track, right?
Mm-hmm.
But it can get us there quicker
Nice.
than if we were trying to do it without a map.
Nice. Okay, so we've talked a little bit. Again, the name of the map that we're talking about is Knowledge to Action. Is that correct?
Mm-hmm.
Okay, cool. So can you tell us just a little bit, because we're not trying to give away your whole session, Karyn, but can you tell us a little bit about, what is this map? We understand that it's collapsing the time it takes to basically get that into practice. But tell us a little more about that and your session.
Yeah, so it starts the center of the image. It has this knowledge translation funnel, right? Where you take like maybe your first order knowledge, you go into second order knowledge, you end up with like a clinical practice guideline or something that's ready to implement.
Yeah, sure.
Then in the surrounding, there's a circle, and on the 6 o'clock position at the very bottom, you either have a question or you have evidence that you want to input. So you can implement, you can choose which way you want to start. Is it that you had a question like how do we implement, or what's the best way to like get patients through the cancer rehab system? Is that prospective surveillance, or is it that we're looking at the study about prospective surveillance now? How do we implement it? Regardless, then you're going to go through and you're going to do a no-do gap. So it's between what we know and then what are we doing in current practice. Yep. And you're going to assess that. And then it's going to be adapting to local context. So we talk about this a lot, right? Your local community, adapting that to your organization and your patients. So maybe you have a strong breast cancer program, but maybe there's another program that you have that's strong in your facility or at your location. So figuring out how do you adapt that to your local context. And then what you see in a lot of the frameworks is they go into assessing barriers and facilitators.
I'm just like heart eyes about all of this. Yes. Keep going.
And it sounds so simple, right? But it's like, oh yeah, that makes sense. Let's do that. Let's assess the barriers. Like what's preventing us? What do we have going for us? How do we change a barrier into a facilitator? How do you bridge that gap? And then you've got to choose your intervention. So what are we going to do about that? If we're implementing like a clinical practice guideline, is that we need to like measure that timed up and go on the floor? Because we want to make sure that we're assessing like functional mobility and we want to like measure that out. Like, is that our intervention? Is that education to our clinicians? Is that changing something about outcomes because we don't have outcome measures? Is that, what does that intervention look like?
Sure.
Then we're going to monitor that knowledge use to make sure that we're actually doing it. We're going to evaluate outcomes because we got to see if it's working. And then at the end, we're going to sustain knowledge use. So how do you keep it going, right? So that 5-year implementation was implementation, but sustainment. Because a program is not one person. A program has to live on after whoever started that program left, right? It's got to live on. And so how do you sustain that? How do you make it bigger than you or your organization? How do you make it sustainable?
I think my heart just grew 3 sizes, Karyn. Like this is so much of the, like our mission as, again, on the OncoPT podcast, we believe fervently in making cancer rehab accessible for everybody and also making it a reality in clinical environments. And I really appreciated at last year's conference. So Nicole Stout was our last speaker on day 2. And, obviously, like, again, we already talked about Nicole Stout in this interview, and one of her big legacies is the prospective surveillance model, along with, obviously there was a team behind that. But she talked in her presentation last year about like, yes, this is one model, by which we can do this. We can monitor and we can, surveil people for these developing impairments, and then ultimately early intervention for the best possible outcomes. But then she followed it up with like, this is one approach. You have to make it work in your area, in your environment. And so I feel like this session is really the spring, like that session last year is the springboard for then this session especially. And what I was so interested in, Karyn, is you're talking through the kind of the steps, or that, the shape of the framework that you're talking about here, and getting down to, we have either a question or, what we're going to evidence that we're going to implement. And then like, it's basically the scientific method in a way. But what I love about this specifically that you're talking about is that sustainability.
Right.
Is it sustainable? And I love that quote, Karyn. This is absolutely a quote I'm going to pull from this interview and like post all over the world. A program is not one person. It has to live on after that person leaves, is gone. And without that, you just had basically a one-person machine.
Right.
And that is not sustainable. It's not sustainable, I think, for the person who's doing that. It's certainly not for the patients, because what's going to happen when they're gone? And then you are left with a gap in the community of where are people supposed to go now for cancer rehab if the program disintegrates when that one person, or even those, few key players, are no longer involved in that.
And so part of what we'll talk about too is building that guiding coalition, like building that team. And so I feel there's a couple different ways that you can do this, right? So within rehab, you need a team. So
Absolutely.
you need that team that's maybe it's implementing the clinical practice guideline for breast cancer related lymphedema. Maybe that's like within rehab, you have your team, your guiding coalition that's doing that. But then you need the guiding coalition that's for prospective surveillance. It's across departments. It involves it could involve IT and the cancer registry. Nurses and nurse navigators. It's huge. It's systems level change. And so I feel like that relationship building to get prospective surveillance off the floor is so important.
Absolutely.
And I feel like the sooner you can start building those relationships and you're educating others, you're informing them about, what the goal is, then you can get people on board to your team. And then all of a sudden things start to grow, because it's not just that one person. It's not just that one department. Now we're a priority over multiple departments.
While your title really talks about utilizing, again, this strategy in a large healthcare system, I think, there's going to be clinicians out there who are like, well, I'm kind of a solo person, or I'm kind of in a silo, whatever. And this is as someone who practices largely on my own, I'm already seeing a lot of this that I can marry into my practice and how I'm working. And I think that's one of the beauties of this, is like, this implementation strategy is not just for the super well established, like hundreds of therapists kind of situation. Like, there are absolutely pearls just from this conversation alone, Karyn, that I'm already pulling. I'm like, oh, this is going to be good. I can already see where this is going to, I can put this into practice with my own patients and whatnot. At the end of your session, I already know attendees are going to be like, whoa, they're going to feel like you felt at the end of last year's conference of, something's big is happening. Now they need to go out and do something. What is maybe one takeaway or one pearl that attendees are going to walk out of that session and be like, that was it. That was it.
So I'd probably say start with a map. You start with a map, and if you're using that map and you hit a roadblock and you're getting kind of confused, you got to go back to the map. And then if you go back to the map and you're like, this still isn't working, maybe you need a different framework.
Sure,
maybe the
absolutely.
knowledge to action framework for your community and your organization, maybe that doesn't actually work. 100%. Maybe you need a different framework. And just to know that there are multiple frameworks out there and that you can go back and kind of start the process over again, and you're already going to be ahead because you've done it once through. There's a lot of power in just having a plan. And then sometimes when you get stuck, it's like, oh, I thought I understood all the things, but you go back and you look at all the steps and you're like, oh, okay, wait, maybe there's another barrier that I missed. Maybe there's, okay, I'm going to go through that process again. And now there's another intervention that I need to go ahead and implement. So I think there's a lot of power in going back to that plan and using strategy. You know, we talk about the large healthcare organization because when you're doing something at scale, you need to have a plan. You need to have focus, right? And so I think that's part of the reason that that's in the title is because if you can figure it out how to do it in a large healthcare organization, then you can simplify that a little bit when you're going to a smaller organization or you're going to a clinic, right? But the framework, the steps that you take are going to be the same regardless. If you're in a large organization or a small organization or a small clinic.
Yeah, absolutely. Can you talk a little bit about your experience? So, you know, in your current institution, you are program director of this. How have you been leveraging this and these concepts into your own practice and your own institution?
So I'm trying not to give too much away.
Right. Just little snippets here.
But yeah. So I think one of the things that we've done is we're on like a quality improvement project with our cancer registry, right? And so this is for specifically lower extremity lymphedema surveillance, right? And so it's all like urogenital, pelvic cancers, like anybody who had radiation or lymph nodes removed, we want to see them before they have their treatment. And so we have like our quality initiative. We've got support at our like our subcommittee meetings for GYN cancer leadership. And so I think having that cancer registry support and having that platform to share quarterly about this is where we're going, and then having that support to help identify, okay, what are the criteria to send a referral? And then we found that, okay, we're not getting the referrals we need. Maybe we have too much on our criteria. Maybe we need to simplify. And having that kind of feedback, you know, and that collaboration to go ahead and simplify, and also have somebody else on your team that's advocating for this because now they have a quality improvement project and they want to be able to check the box and be done with that, right? Absolutely. We want to say we had this project and we were successful. So I think it goes back to relationships. It goes back to that collaboration. And then the other thing that I'll say is just within rehab, we've had a lot of improvement just with the idea of implementation science, like educating our teams about implementation science, letting them know that all of our we have clinical ambassadors, we have leads, we have supervisors, we have managers, but we're all part of this guiding coalition to be the best evidence-based, preeminent healthcare rehab organization that we can be, right? And so we're all working together on the same goal. And so everybody's a champion. Everybody's encouraging best practice. And so building that like guiding coalition to help implement evidence into practice, I think has been super powerful.
I feel like over the past few years, I've heard a lot of talk about, you know, and I also encourage this of like find a champion, you know, when we're going and trying to establish, you know, those relationships with oncologists and oncology centers to build that connection, that bridge, if you will, from cancer treatment to cancer rehab. But I really am excited to learn more about this. Everybody is a champion in like taking ownership of this. And it's even just like that language, that connotation of like everybody has a stake in making this work. And I'm very excited to learn more, Karyn. I won't make you give any more away, but I'm just like, I am really, really interested to see more of this and how it's working. And then I know obviously like there's a lot of action steps and clinical pearls that people are going to walk away from your session with. But like the gears are already turning. I'm very much looking forward to this session.
Yes. Yes. I feel like that guiding coalition, I feel like we've also had a lot of conversations about leading change.
Mm-hmm.
Right? Because anytime you're changing practice, like you're going through that unfreezing process, you're disrupting the status quo. And how do you lead change and do that well? Apparently there's a lot out there on leading change. There's between implementation science and leading change, I'm like, oh my gosh, this past year has been amazing.
That's so exciting. What are you most excited about? So obviously, like we've talked up your session, which once again is titled Utilizing Implementation Strategy to Guide Prospective Cancer Surveillance in a Large Healthcare System. We've talked a lot about your session. We are very, very excited for your session. What else are you excited for to happen at the Cancer Rehab Community Conference 2025?
So my husband and I were talking about this because I loved the chat. I know that sounds silly, but I love the chat. It's like, I feel like sometimes you sign up and you're doing this like live virtual conference and you're live virtual, but like they're just talking to you and they don't want to be distracted, right?
Right.
But this was live virtual and it felt live because it was like, I mean, between all the gifts that were going on.
Oh my gosh.
And then it was like everybody like adding in like something that they found valuable, like a pearl, or they'll like hear something and then they'll like repeat it back in the chat. And I feel like that repeating it back is so powerful, right? Taking that like quote or that tidbit or whatever it is, and then let me re-emphasize that. There was so much that just happened. I feel like you could just have like, okay, a compilation of all the little pearls that were in that chat, and that would be amazing.
Honestly.
But yeah, I feel like the speakers were awesome last year. I feel like I got back into practice and immediately was like massaging people's feet.
Yes, from Katie's. Yes.
And I was like, I just went to this conference and I'm going to massage your feet and we're going to get in here to like all the little intrinsic foot muscles. And,
oh my gosh.
And it was powerful. It was really powerful.
For those of you who weren't present at last year's conference, that would be Dr. Katie Schmidt's CIPN presentation. And she on camera was walking us through like how to give different CIPN massage. It's great. That makes me so excited, Karyn. I feel like it's such a strange concept to talk about. Unless you've seen the chat, it's hard to appreciate. And like as the MC of the event, it fires me up because again, it is like as close as we can get to being in a room and like having people cheer and being able to facilitate those conversations. Like I think this is the closest that we can get in a virtual capacity. And I think that is so exciting. I'm so thrilled that you've had such a wonderful experience with that. And that's also, you know, one of the things that I really appreciate from a viewer perspective on that. Like I go to conferences fairly frequently throughout the year. And I feel like I don't always catch clinical pearls on the first go around, right? But if someone is putting that into the chat, it's much easier to be like, oh my gosh, that's what that means. That's what she said. Or, oh, I'm going to make sure and write that down so that I can reference that in the future kind of thing. So, I'm very, very much looking forward to it. I have very high expectations once again. I think Adam and Alex at the first conference were the ones who discovered the whole gift thing, and it just took off from there. So very much looking forward to that. What would you tell somebody who hasn't been to the Cancer Rehab Community Conference before and is on the fence about registering for this year?
I feel like it's an experience. I think, I would say go for it. I feel like do it. Like it's a cool experience. I feel like to be around so many people that are passionate and like-minded and want to just like practice at the top of their profession. And I don't know, there's so much beauty to that, right? And then to have that experience and then leave and be like, you know, there's a couple like concrete things, yes, I'm doing, but also just this feeling of I want to be better. right? I want to do more. Like I'm feeling like that inspired feeling, right? And then do it with a mindset of, is there something that you can contribute to the next conference, right? Because I think that's the beauty of having like speakers come in that maybe we're not people that normally do a lot of public speaking, right? But
Absolutely.
to have this platform with people that get it
Mm-hmm.
and want to get it, I think
Mm-hmm.
it's powerful. So I would just say do it. Do it.
Thank you so much, Karyn. We really, really appreciate that. I mean, again, I'm extremely biased, but this is absolutely my favorite conference of the whole year. And I'm very excited to be having it back. We are just actually, as we're recording this, we are just a month out. So we are counting down the days at this point. Karyn, where can people find you and connect with you now that they've gotten to know a little bit about what your amazing session is all about?
I would say LinkedIn. So it's Karyn, Karyn, and then Jarrett, Jarrett. So Karyn Jarrett on LinkedIn.
Perfect. And we'll link that in the show notes as well so that you can find and connect with Karyn. Once again, Karyn's session at the upcoming Cancer Rehab Community Conference is titled Utilizing Implementation Strategy to Guide Prospective Cancer Surveillance in a Large Healthcare System. This is an incredible session. I already have so many ideas floating around in my head just from this preview episode that we did. So if you think that's good, just wait until the real session on November 7th and 8th at the Cancer Rehab Community Conference 2025. Karyn, thank you so much for joining me today. I really, really appreciate you sharing your time and your expertise with my listeners. And until next time, this is Elise with the OncoPT. And remember, you are exactly the physical therapist that your patients with cancer need. So let's get to work.
Thank you so much for listening to this episode of the OncoPT podcast. If you'd like to help support the podcast, please share it with others, leave a rating and review, or support us on Patreon.